Today, I would like to talk to you about survivor-centered approaches to working and providing MHPSS support, mental health and psychosocial support to survivors of gender-based violence. So what I would like to do is to start maybe explaining what do we call gender-based violence in emergencies, then see what it's a survivor-centered approach, and then dig a little bit on what can we do as mental health and psychosocial support professionals to make sure that what we do with survivors is person-centered and survivor-centered. So gender-based violence is any type of violence that is rooted in the gender of the person that is a survivor of such violence. It affects mostly women and girls, but also members of the LGBTQI+ community, and in some contexts also men and boys that can be, for example, targeted with sexual violence. Gender-based violence happens in all contexts, in all countries, in all communities, unfortunately. But it's also true that in humanitarian settings, gender-based violence tends to increase tragically. And we have a series of teams that are very much looking into the safety and support to these persons, especially women and girls. So when we talk about survivor-centered approaches, what we mean is a type of approach, a type of a skill that is going to put at the center of the work the survivor's needs and the survivor's wishes and their expertise. They know about their own lives much better than any of us. So what we do with these approaches is to look into how can we prevent, how can we address, and how can we provide care for survivors of sexual and gender-based violence. What we're going to do with this approach is to look into the rights, make sure that they're safe first and foremost, and make sure that the wishes, what they need to be happening at each step of our support, are at the center. A survivor-centered approach, it is both therapeutical, because the way in which we welcome women, the way in which we allow them to guide the process and to lead it, is in itself caring, and is in itself going to make them feel better. But it's also political, because we are going to be always paying attention at what are those root causes which are systemic and which are social that are creating and maintaining sexual and gender-based violence. As MHPSS, as mental health and psychosocial support workers, it's important that we are very knowledgeable of these survivor-centered approaches, because many women and girls are going to choose to request mental health and psychosocial support services to care for that part of their well-being that is being affected by their situation. How can we do this? How can we be better informed MHPSS professionals and support the gender-based violence survivors? Well, first and foremost, we need to become very good friends with our GBV case managers, all of those colleagues that are holding hands with the survivors and helping them decide what is going to come next. They are going to inform them about the services that they have available, from legal services to health services, and they're going to guide their cases so they are always having what they need. They're going to be a focal point, and often they're going to be the one referring the survivors to us. So we need to know who they are, where they are in our area, and how can we work together. Once that is in place, the other very important thing to do is to make sure that we follow that same process. And that first and foremost, we listen. We know that they know what they need. We know the survivors are going to have a better understanding, for example, of safety considerations. Maybe we want to recommend things that is not possible to do yet because they are still living with the perpetrator, because there's still things in the community that need to change for them to be able to address the next level of care. So we need to listen, and we need to put their wishes, their ideas, and their input at the center of our care. Once we've done that, we are already in a much better place. We will continue to look into safety, confidentiality, and also non-discrimination, making sure that our services are available to everybody. Finally, we're going to continue to be connected with the GBV experts. So when we are developing our processes, we stay connected. We inform them. We also continue to forward to other services and other professionals, but we let them lead the process. Finally, there are many things that we can do to make sure that gender-based violence survivors have access to care, while we protect them and we make sure that we don't show their situation. For example, as mental health and psychosocial support professional, you can make sure that anybody entering your services is provided with information about the services available. So then you don't need to wait for disclosure. they don't feel that they need to disclose to you or to the services that they're entering in order to get support. Everybody will be provided this information, and then they can take it home, they can reflect on it, and they can reach out when they are ready to get those services. So as you can see, there's many things that we can do, and mental health and psychosocial support professionals, we do carry in principle these methodologies. We know confidentiality is essential. We always protect the well-being of our customers and the people we support. So it's the same with gender-based violence. Survivor-centered approaches are very close to the nature of our MHPSS work, but we need to make sure that we understand them and that we use them on a daily basis.